Good evening. We are Team Resilient Responders, comprising Natalie Gay Sutherland, Marlon Cayoni, Colin Furlong, Byron Lee, and myself, Omati Seju. Today, we are proud to present our CERT simulation exercise entitled Head-to-Toe Assessment in a Post-Earthquake Scenario. The simulation is set in the aftermath of a 6.7 magnitude earthquake that struck a rural village. As CERT volunteers, our mission was to assess and manage victims rescued from collapsed structures by other CERT team members using leveraging and cribbing techniques and other search and rescue methods. Once extricated, each victim was tagged by the cribbing and leveraging teams based solely on what was presented upon rescue. The victims were then brought to a casualty collection point where our team performed systematic head-to-toe assessments before assigning triage tags based on urgency. This process tested not only our medical response skills, but also our ability to communicate calmly and work cohesively under pressure. Our key objectives included conducting thorough primary assessments, prioritizing care using the CERT triage system, and providing reassurance to victims in distress. In this simulation, you'll see how each team member played a vital role, from medical assessors described to team lead, working together to save lives and restore order in a chaotic environment. We now invite you to observe our simulation, and we welcome any questions or feedback after the presentation. Thank you. Our teams are equipped and ready. CERT Medical Team 1 and CERT Medical Team 2 will each take responsibility for assessing victims, while I monitor and document findings. Medical Team 1 begins with Victim 1, who is conscious but disoriented. They introduce themselves and obtain verbal consent to begin a systematic head-to-toe assessment. Victim 1 responds to verbal cues, indicating an alert but confused state. Upon inspection, the left arm is swollen and painful. There is suspicion of a fracture. Using the DCAP BTLS guide as a point of reference, the CERT team begin their examination. They look for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. Starting at the head, the CERT member checks for any visible injuries. They examine the eyes, ears, nose, and mouth for fluid, blood, or obstructions, and inspect the neck for bruising or signs of trauma. One member carried out the physical examination while the other member held the victim's head and neck stable. The examining member often checks his hands to see if there was blood or any fluid on his glove. Next, they assess the shoulders, gently feeling for any fractures or dislocations. Taking care not to interfere with the left arm, they moved to the chest. They look for equal rise and fall and listen for any abnormal breathing sounds. They gently palpitate the chest area to check for tenderness or pain. Then, they examine the right arm, starting at the top of the arm and going all the way down to the fingers, where they check for capillary flow, which should be less than 2 seconds. I observed that Marlon's glove on his left hand was torn. He was quickly advised of this. The examination halted temporarily, glove was changed, and then the examination was allowed to continue without any further incident. The examination progresses to the abdomen and pelvis area. The responder lightly palpates the abdomen for tenderness, rigidity, or distension, and checks the pelvis for stability by gently pressing inward and downward. Each leg is then assessed for fractures, bleeding, and circulation. The team member checks for movement and sensation in the toes. This also includes testing for capillary flow. In order to complete the examination and ensure that there are no injuries to the victim's back, while holding the neck and head stable, the victim is turned gently and an examination of his back is done to assess for any injuries or deformities. In order to avoid excessive movement of the victim, a backboard is placed under the victim prior to returning him on his back in the lying position. The CERT team recognizes that the victim is conscious with no obvious respiratory issues. He was not bleeding, and as a result, the red tag that was placed by the cribbing and leveraging team was changed to green, and the victim was then forwarded to triage for further attention. After performing a quick scene size-up and determining it was safe to approach, Medical Team 2 approached Victim 2. Their attention was immediately drawn to the fact that the victim's breathing was labored and there was uneven chest rise. They also observed that his right leg was significantly swollen and discolored. It was also noted that the cribbing and leveraging team had tagged the victim red. Having made these observations, the team knew that quick assessment was required to ensure that there were no other non-obvious injuries before forwarding the victim to the triage. The examination then proceeded to neck, shoulders, and chest. The victim immediately reacted to touch when the chest area was examined. This indicated some possible internal injuries. The examination continued and the right arm was examined. It was observed that capillary flow to the fingers was restricted. Upon examining the abdomen, the victim moaned audibly. This indicated further possible internal injury. The same reaction was received as soon as the right leg was touched. The lower limbs were cool to touch, and upon examination, the toes were discolored. There was no pain to the left leg or arm. In order to ascertain that there were no injuries to the back, the patient was carefully turned on his left side and the back examined. Having already been tagged red at cribbing and leveraging, this status was maintained and triage was informed of the urgency for treatment for this victim. The victim was then handed over. It is also important to note that both examinations conducted by Medical Team 1 and Medical Team 2 were conducted simultaneously. Both victims were presenting with red tags that determined urgency in examination. As a result, the narration for Team 1 was done in real time, while the narration for Team 2 was done after the fact. With all assessments complete, I report our findings to Incident Command. Victim 1 was tagged green after being initially tagged red, and Victim 2 was tagged red for urgent attention. All victims are now transferred to the triage zone, where medical teams will conduct further evaluations and prepare transport if necessary. Our team then regroups, and Incident Command is informed that our team remains on standby, ready to assist with additional tasks as needed. In every response, the safety and dignity of survivors are our priority. Through clear communication, efficient teamwork, and compassionate care, we ensure no one is left behind. This concludes the CERT Head-to-Toe Assessment Simulation. Thank you for watching.